Hey guys, if you are confused by Medicare and what it does and doesn't cover, and if the enrollment process seems just a little intimidating, then you are in the right place because over the next few minutes we're going to learn about the coverages that Medicare has to offer, we're going to discuss supplement options, and we're going to show you how to get enrolled in Medicare and in Medicare supplements. My hope is that by the end of this video that you will have a good working knowledge of how Medicare works and how to get enrolled. My name is Bobby Jones and my company is Delta Benefits Group. If you have any questions, feel free to call me toll free 888-449-7716 or send me an email to info@deltabenefitsgroup.com. I've just finished writing the book Medicare for Beginners, a guide to understanding and enrolling in Medicare. It's up to date with all the 2017 figures. It's available on Amazon and Kindle version. And if you stay with me throughout the video, at the end, I'm going to give you a link where you can click on and get a free copy. Let's get started. Medicare is made up of several working parts that are signified by letters A through D. We're going to briefly discuss each of these parts in order for you to get a better working knowledge of Medicare. We're going to begin our discussion with Medicare Part A. Medicare Part A is going to cover inpatient hospital, inpatient skilled nursing facility like a rehab unit, hospice care, and home health care. So let's talk about Part A deductibles and copays. To begin with, Part A has a $1,316 deductible per benefit period. That's not an annual deductible, it's per benefit period. Now, a benefit period begins the first day that you're in the hospital and it ends after you've been out for 60 days. Therefore, it's conceivable for someone to have multiple deductible Part A deductibles over the course of a year. As far as your copays go, now these are consecutive days. If you're in the hospital between 0 and 60 consecutive days, you're not going to have a copay. It's $0. Now, in the unlikely event that you're in longer than 60, from day 61 to 90, you're going to have a $329 a day copay. Beyond 90, you're in what's called your lifetime reserve days. And each lifetime reserve day that you use, you're going to have to pay $658. Now, over the course of your life, you're only allowed a total of 60 lifetime reserve days. And once these are used up, you're on your own. Premiums for Part A. Part A is typically free as long as you've paid into Medicare for 40 quarters over your working life. If you have not, but you've paid in at least 30 quarters, but not the full 40, your premium will be $227 a month. If you've not paid in the 30, you paid less than that, your premium will be $413 a month. Now moving on to Part B. Medicare Part B covers medically necessary doctor services, outpatient care, durable medical equipment, and preventative services. Part B deductibles and copays. For 2017, the Part B deductible is $183 a year. Now that typically changes every year. Last year, 2016, the deductible was $166, but this year it's $183, and that is a one-time annual deductible. After your deductible is met, there's a 20% copay. Medicare is going to take care of 80%, and you're going to be responsible for 20%. And there is no limit to what that 20% could cost you. Part B premiums, have a table that kind of spells it out. Part B premiums for 2017, if you're just coming into Medicare, is going to be based on what you made in 2015. The table here shows, I hope you can see it, that if you made $85,000 or less, your Part B premium for 2017 is going to be $134 a month. And it goes on up to as high as $428.60 a month. And that is if you made individually above $214,000 or filing jointly above $428,000. So how to enroll in Parts A and B. Part A is going to be automatic. It's going to come 3 months prior to your birth month when you're turning 65. Now, Medicare always starts on the first of the month. If your birthday is, say, May the 25th, your Medicare is going to begin May the 1st. Part B is going to be automatic if you're already receiving Social Security. But if you're not, there's 3 ways that you can enroll. First, you can visit your local Social Security office and enroll, or you can enroll online at ssa.gov/Medicare/ and I'll leave this up here for a second so you have time to write it down if you want. Or you can call Social Security direct at 1-800-772-1213 and apply on phone. Medicare Part D is going to cover your prescription drugs. It's offered by private insurance companies that are Medicare approved. Now the premiums, they're going to vary according to the deductible that you choose, the copay, and the formularies. And now the formulary is just a list of drugs that each individual insurance company carries on their Part D. Medicare for Beginner has a really good chapter on Part D deductibles, copays, and the donut hole. And if you remember at the end of this video, I'm going to give you a link that you can get you a free copy of that, and you can read that chapter, and it goes into it, I think, fairly extensively to where you get a good understanding of how it works. It's a little bit long for this video. My advice is always to my clients is to call Medicare Direct, 1-800-633-4227. That's the best way to enroll in your Medicare Part D. And the reason for that is it's really hard, or almost impossible, I should say, for an agent to have every plan available, because there are scores and scores of them. And in order to give you the best service, my advice is always call Medicare because they have every plan. You can go through your prescriptions. You can go through the pharmacy that you like to use. Go over that with them, and together you guys can come up with the best plan, and they can enroll you in your Part D on the spot. Also, I would advise you to call late at night as you can stand, because that'll usually get you to the Arizona office. Now, the Arizona office has always been extremely helpful and offers, in my opinion, and in my client's opinion, the very best service. We're going to talk for a minute about Medicare Advantage, which is Part C. We kind of sidestepped a little bit. We've covered A, B, and D. Now we're going to backtrack a little bit and fill in the gap there and talk about Part C. The reason I did it like this is because Part C, or Medicare Advantage, is optional. It's just another way to receive your Medicare coverage, and it's offered by private insurance companies that are approved by Medicare. But now you're going to get your Part A and your Part B coverage from the Medicare Advantage plan, no longer from original Medicare. Medicare Advantage is more similar to traditional health insurance with either an HMO or a PPO. Continuing with our discussion of Medicare Advantage, some of the pros, some of the good things about Medicare Advantage, it provides supplementation for a lower premium than what your traditional Medicare supplements will cost you. Also, typically, your Part D drug coverage is going to be included in your Medicare Advantage plan, as is some very basic dental and vision, usually preventative only. Some of the kinds of a Medicare Advantage plan is a defined and limited choice of doctors and hospitals. You kind of give up your right to go wherever you want to go. There is a list. Again, it's a PPO or an HMO, so there's a group of doctors that you have to choose from. And usually, if you're not able to go outside that group without incurring additional cost. Also, you have copays and deductibles with a Medicare Advantage plan, and they can range from $4,000 to $6,000 annually. We're going to spend the next couple of minutes covering Medicare supplements, or Medigap insurance. And Medigap insurance is also provided by private insurance companies that are approved by Medicare. And Medigap coverage is designed to fill the gaps in Medicare Parts A and B that we have discussed earlier, like your deductibles and your copays. We're going to discuss 3 of the most popular Medigap plans, which are Plan F, Plan G, and Plan N. This is a really good chart. It's a supplement comparison chart Came from the Medicare and You book. It's kind of the guidebook for Medicare, put out by CMS, and you'll hear me refer to CMS from time to time. And CMS is the Center for Medicare and Medicaid Services. But anyway, if you look at this chart here, you'll see I've got F, G, and N highlighted, and I hope you can see these numbers. But starting with F, you see it's 100% coverage of pretty much everything with the exception of your foreign travel, which is an 80%. But anything in the United States, Plan F is going to cover 100% of. Plan G is going to cover 100% of everything, just like F, with the exception of, the only difference is Part B deductible, Plan G does not cover. So if you have a Plan G, you're going to be responsible. Remember, this year the Part B deductible is $183. So you're going to be responsible for the first $183. When you go to the doctor, you have outpatient surgeries, you're going to be responsible for that. After that, it's 100% coverage. Now, Plan N is similar to G with the exception of, if you look there on the second row, it's got Medicare Part B, and you got two asterisks there. Now, what those two asterisks for is, number one, if you go to the doctor with a Plan N, you're going to have a copay. Now, that copay is up to $20. It's not always $20. It could be less. That's why they say up to. I have clients that have gone with a Plan N, and they let me know that their deductible was $11 or $12. Always plan on the 20. It can't be more, but up to 20. And also, it's got an emergency room copay of up to $50 if you're not admitted. So if you get a cut on your hand and you go and have it stitched up at the emergency room, you're going to be subject to up to a $50 copay if you have a Plan N. Come on down to the bottom. You see again the Part B deductible is not covered under Plan N, that $183. And then you've got your Part B excess charges, which are covered by F and G only, but in Plan N that's not covered. Now, I'm going to talk about Part B excess a couple of slides ahead here, but anyway, just kind of keep that in the back of your mind that Plan N does not cover the Part B excess. I wanted to show you guys this. This is very important. This is out of Medicare and You 2017, and it says Medigap policies are standardized. What this basically means is that within a plan, within a G, within an F, within an N, they're all identical. Aetna's is no different from Mutual of Omaha's, which is no different from Cigna's, which is no different from some of the smaller companies you may or may not have heard of, Manhattan Life or New Era. They're all identical. CMS writes the plan, and they'll go to these companies and say, for whatever particular state, would you like to carry a Plan G in this particular state? And you can't add to it, you can't take away from it, you can't alter it in any form. You can charge what you like to for it, but you can't change it. You have to offer it as is. And either the companies will say, yeah, we'd like to go into that state, or no, we would not, and they go from there. So basically the only difference in anybody's Plan F or anybody's Plan G or anybody's Plan N is the price that they charge. Let's compare Plan F and Plan G. Plan F, if you remember, is 100% coverage with no out-of-pocket. Plan G is 100% coverage. The only exception is that Plan G does not cover your Part B deductible, which in 2017 is $183. You have a Plan G, you're going to have to pay that $183. The cost of a Plan F, and I just used a 65-year-old male in Dallas, the monthly premium is $143.61. Now that's with Cigna, who was the least expensive carrier in that market. The same man with Cigna on a Plan G is $116.45. Now, that's a $27.16 a month higher premium on the F than it is in the G, or about $326 a year. So the question, I guess, would be, why would you pay somebody $326 a year to pay $183 for you? So in my opinion, the best value would be the Plan G. Don't pay a convenience charge of $143. Pay your own deductible and save. Some other considerations to look at when comparing an F and a G is a Plan F generally has a greater percentage increase in premiums each year than does a Plan G. 2019 is the last year that a Plan F is going to be available for new enrollees. Now, if you have an F, you will be able to keep it, but due to the aging population within an F, the premiums are subject to rise even more dramatically. Now, what I mean by that is if no new young 65-year-olds are allowed after 2019 to come into the Plan F, well, obviously 5 years down the road, the youngest person in an F is going to be 70, and 5 more years, 75 years old. Well, the insurance company bases their premiums on experience, and experience is just another way of saying how much money they have to pay out in claims. Well, it stands to reason that as the population gets older, the claims are going to be a little bit higher. Therefore, the premiums are going to go up more dramatically. So let's talk about Plan N for a second. Plan N is typically the least expensive of the three plans that we're talking about between the F, the G, and the N. And a Plan N is similar to a G, with the exception of two things. Like we've talked about, number one is the copays that you pay when you go to the doctor of up to $20 a visit. And then again, in the emergency room, it's up to $50. Now, that's if you're not admitted. If of course, if you go into the emergency room or admitted into the hospital, they don't charge you the copay. The second is the Part B excess that Plan N does not cover. Plan F and G do cover Part B excess, but Plan N does not. So let me explain Part B excess like this. Really, there's three kinds of doctors. There's a doctor who doesn't take Medicare, and that's very rare to find one of those, but they are out there. The second one will be a doctor who takes Medicare assignment. Now, that means that whatever that Medicare pays them, they're happy with, and that's the end of the billing. The third one is a doctor who will take Medicare payments. Now, that is to say that they will take the payment that Medicare gives them, but if there's a difference in that and what they charge, they're going to want to be compensated for that, and they'll come to the patient to get that money. So some doctors, like I said, they charge the difference between what Medicare pays and the actual charge. Now, this charge cannot exceed 15%. So if the bill is $150, Medicare pays him $100, well, he can only charge another $15. Well, that $15, that 15%, is called the Part B excess. I hope that makes that clear. If it doesn't, feel free to call me and we can go into that a little bit deeper because sometimes it's a hard concept to grasp. So, how do we get enrolled in Medicare supplements? The open enrollment for a Medigap policy lasts for 6 months. It begins on the first day of the month in which you are both 65 or older and enrolled in Medicare Part B. Most Medigap insurance company will allow you to enroll in your policy 6 months before your open enrollment period begins. The advantage to doing this is that it'll provide you with that 18-month price guarantee. So for that 6-month period where you don't have coverage and you're not paying for it, but for that 6-month period that you're enrolled before your Medicare begins, of course the price won't go up. And then that entire year, your first year, the price can't go up either. So that's the advantage to go ahead and enrolling early. It's important for you to know that during your open enrollment period, you can enroll in whatever Medigap policy you choose with no health questions whatsoever. The issue is guaranteed. But after your open enrollment period, your Medigap open enrollment period has ended, insurance companies issuing Medigap will conduct a prescription check and require that you answer medical questions, and they can decline you based on the information that you've given. Therefore, it is vital to take advantage of your Medigap open enrollment period. So why choose Delta Benefits Group as your Medicare representative? Well, first off, we are a nationwide agency with every top carrier in your market. You're always going to get the very best value. We're going to educate you. We're going to keep you up to date with Medicare. We're going to shop your premium every year to assure that you're getting the very best coverage at the very best price. And most importantly, our services are absolutely free to you. We are compensated by the insurance company. And further along that lines is there is no price difference in what you can go directly to the insurance company to get your Medicare supplement plan versus what you can get it through us. So that's important to know. The only difference is going to be that we're going to service you. We're going to make sure that you're educated. And we're going to keep you up to date. Well, that's it, guys. Thanks so much for listening. I hope that you know a little bit more about Medicare now than you did 20 minutes ago. You've learned some things about the coverages and about how to enroll and about the supplementation. My information is on the screen. Feel free to call me if you've got any questions. Call me. There's a toll-free number, or email me, info@deltabenefitsgroup.com, or in the comments below. Post your questions down there. And do me a favor, if you will. If you enjoyed the video, give me a like on the video and maybe share it with a friend. I would really appreciate that. And one more thing, almost forgot, the free book, Medicare for Beginners. I'm going to click on the link that I'm putting up here now. So just click on this link and the book will be yours. So thanks so much again for listening, and best of luck to you. I hope to hear from you soon.